To me, it really is about measuring force and time.
Mm-hmm.
You can sit there with articulating paper and look at all the dots that you want. And, time and time again, I know you know this, big dot, small dot, no dot. It doesn't mean anything, and when you're doing a lot of all ceramic dentistry with, glazed ceramics, it gets hard to get an arch, and get teeth to mark.
Mm-hmm.
So, to me, looking at it and practicing with it for, I think it's 16 years now, thankfully my remake rate with my lab is extremely low.
Mm-hmm.
My fracture rate is extremely low. And I know the reason for that is because I'm able to measure the force that patients are putting on their dentistry.
TechScan is a tool in my tool belt that I utilize when I need, given the patient's situation. So I do have some patients who come in with illicit symptoms of malocclusion, myalgia, muscle pain, tenderness in the joints, and I suspect it could be malocclusion that's causing all of that.
Mm-hmm.
What better way or easier way to actually introduce that concept by showing them a digital map of the timing of their occlusion and having them understand that it's a misalignment of how their teeth fit together. I have a philosophy of wanting to use it during the treatment as opposed to after the fact.
Mm-hmm.
Right? So fine tuning and finessing our occlusion is not something that we have to deal with as an afterthought. Perhaps we can use it during the process of treating a patient to fine tune that so that we don't have to get into a situation where the patient's having a malocclusion and the resulting sequelae of pain and discomfort, and then using TechScan to figure out what's causing it.
Mm-hmm.
Sometimes we can use technology and should be using technology as part of the treatment as opposed to an afterthought.